So my name's Gary Whittet. I'm a professor of medicine at the University of Adelaide. I'm an endocrinologist. I work at the Royal Adelaide Hospital, and I'm based at the South Australian Institute for Health and Medical Research. 26% of the South Australian population, in very similar proportion throughout Australia, are people who've born elsewhere. I mean, many of them come from countries where they have very different healthcare systems, but also very different cultures and ways of thinking about different health problems. So when it comes to mental health, the conceptualization of mental health could be vastly different.
My name's Niall Fay. I'm the CEO of the Fay Fuller Foundation. So we're a private foundation, a private philanthropic foundation that funds into mental health and wellbeing. But specifically from an outcome perspective, what we're looking at is working and funding into the preventative end of the mental health and wellbeing spectrum, in particular working with community groups to imagine what prevention responses look like, led by community. What we hope to demonstrate not only to the likes of government, is to other philanthropic organisations and other funding organisations that you can show up in a different way and you can work in a different way.
My name is Ukash Ahmed. I'm the coordinator of programs at MCCSA. The Multicultural Men Mental Health Community Connections Project is a 2-year discovery project funded by the Fay Fuller Foundation. And it's a consortium project that brings together the Multicultural Communities Council of South Australia, where I work, and 4 core community groups: the Latin American Society of South Australia, Australian for Syria, the Kabudu Men's Club, and the Burundian Community.
Grant processes like Discovery are all about discovery at the heart, about allowing communities to be curious along the way.
It's their way of work. It's just give the community the space, create the conditions for them to thrive, and watch the magic happens.
So in a lot of instances, a relationship between a funding organisation and an organisation seeking funding is based on a tension of distrust. Philanthropy can act and do things in a certain way that government can't. And so we can start to work in community to surface up the types of responses that can be really effective in achieving outcomes for community.
Even men in Australia experience mental health conditions in a different way to the way that women do, and that tends not to be recognised either by the men themselves and very often not by healthcare professionals, creating this mass discrepancy between the prevalence of mental health conditions and the recognition and treatment offered. So you take those two things and you get a much more exaggerated problem among those people that are not born in Australia, and particularly for recent migrants. They've now got this clash of culture problem where they've got children that are adopting Western style or different values. They've got to adapt to a new culture. They may have patriarchal systems within the family that have to adjust to Australian values around patriarchy and equity within families and so on. And all of these things, plus the financial problems of adjusting to a new environment and getting work and supporting your family. All of these things bear pressure on the mental health of men even more.
MCCSA has had pre-existing relationship with these communities, and some of them we have worked with them on a number of other projects. So when we did the expression of interest for the project, we had to almost have those conversations loosely with those communities, and from the first minute they were like, yeah, we want to be part of the project. So it wasn't difficult.
This program is a 1 in a million program. It's a very unique program because it doesn't put you in a box. It gives you an opportunity. It gives you a chance to grow. Like, you're not told, okay, this is what you have to do about mental health. You're told, here is some fund, organize yourself, find ways in which you can talk about mental health in a way that it will benefit you.
I'm a community connector and educator. From the beginning, our intention was not to provide mental health services, but to start a communication on what it means to talk about mental health, how it's perceived in different communities, different countries, different stages of life, different stages of migration. That is really interesting to see how different cohorts, different groups perceive the conversation about mental health in such various ways.
There is a lot of stigma in mental health in the coward population. It's not seen as an illness. It's seen as someone who hasn't been brought up correctly, and people don't talk about mental health, and people with mental health issues are not getting help that they require. So we have been trying to get cowed men to come together, talk about their problems, talk about what they are in an environment where there is professionals who can help them, and then give them the techniques to deal with challenges in mental health.
My name is Ratib Al-Khalil. I'm a community connector. We work for Australian, for Syrian. All of them come from our country. We have war there. Too many people have different problems for mental health. We have joined the project with Brother Okash, work with the MCCSA, and yeah, that's very good project for our community. Yeah.
We started having conversation. That was the first step, just to talk about it, to be man enough to talk about it.
The best people that know community are actual community themselves. So they can look past data, they can look past statistics, they can look to what's actually really happening in community that's leading to poorer mental health and wellbeing outcomes, and actually can determine responses that work towards those root causes in a preventative sense to ultimately deliver better long-term mental health and wellbeing outcomes for community.
Our challenge wasn't we were not kind of like KPI focused. We wanted to make sure that we're trying to build something sustainable at community level, and we were also managing risk factors that come with having mental health conversation on the same goal. So we didn't want someone who wants to volunteer their time for community had to deal with complex mental conversations that we're not trained in. So handling all those was challenging, but at the same time fun for me.
My name's John Mannion, and I'm the CEO of Breakthrough Mental Health Research Foundation. We got involved in the project because we've had a relationship with the multicultural group, and specifically the men's group, for a couple of years. And when they approached us to say, could you start to assist us in some of the mental health training? Could you bring a different approach together? It was really exciting to do something very different with a beautiful community.
We had two overarching objectives that we wanted to achieve. One was obviously stigma reduction at community level and normalized conversation around mental health through community lens. And the next thing was attempt to influence the system in terms of how people from culturally and linguistically diverse background access mental health services, which traditionally has been a bit challenging because of the cultural and religious consideration. So we wanted to take the learning from community and the community aspirations and then have a conversation with service providers in the mental health space to be able to then adapt their service to better suit the needs of those communities.
You approach the community, firstly you want to understand what they understand, because otherwise we make assumptions what people know and what people think. So you have to understand firstly, what do the community know, what do the community understand, what are the barriers to care, and what systems of care can be put in place that would be acceptable to the community, and how can those systems be supported and sustained.
Part of the support we gave to the project was the delivery of mental health first aid training. Now, that training normally takes place over 2 full days. Most of the people that were taking part in the training actually have full-time jobs. So we wanted to look at a way in which we can make it accessible. So we split it over 4 consecutive weeks. We did it over 3-hour sessions. We did it in an evening where we could actually have a meal together and then do the training, so it actually became part of that community connectivity.
You know, the duration we had was good. It's flexible, you know, because we all are busy people, you know, so it was quite good, you know, and you have enough time to absorb and reflect over what you did, you know, first week and so on to the last week.
By explaining in those multiple days that you guys actually done, it gave us the opportunity to think about it. You know, from week to week, you need that time frame in between because you start thinking about it. And that's what it happens to me, actually. And it takes away those pressures and thinking about going back to work or doing this or what's happening in the office. I think it was a good idea.
So this was the very first time that I'd run a training session where I had an interpreter for the whole session. In fact, it was so incredible having the interpreter involved that we actually got the interpreter qualified in mental health first aid because he'd spoke everything I spoke for the last 4 sessions.
But when you do mental health first aid, you end up getting this understanding of how to talk to people. It's not about being a professional, but it's just sometimes talking to someone. If you see someone seems to be in a trouble or in a problem, which most times happen in our community, you know how to engage them, you know how to approach them, because we're not professionals, so we're not going to help people solve their problems. But we can identify problems, and we at the same time, when we identify a problem, we can engage, have a bit of a chat, and then we can refer.
again, that interaction, that connection, and hearing from other people puts you at ease and allows you to be able to talk about it, you know, or even when you feel like, I shouldn't be saying this or saying that much, but you hear from other people and you know, I'm not in this boat alone. People are facing the same issues, the same circumstances. So as time goes on, you build on it. It becomes better and easier for you to relate, to speak up.
So we have the challenge to get somewhere. We can meet with the people to tell about of the mental health. For us, we help the community to go house by house for visiting. That is very hard. So if we can get the big place where we can meet with a big number with the people, I think can be better and it will help the people to understand about mental health.
They didn't have places to meet, so my challenge was then how can we connect them with local council who have good facilities to allow those men to have like regular ongoing bookings to be able to utilize those facilities, come out and meet once a fortnight, for some once a month, and have a conversation. And about life. It's not about mental health, about life. The way they went about it was, fasting first. Let's create a safe space for us to connect.
A place like this is very, very important because when we are talking with the men from our Burundian community, they ask us, where is our place? Where is the address? Everyone will know how to connect to each other.
I believe that in addition to having events and to having places where we can connect, it's really important to have perhaps a base, a place that is a community space that is constant, is permanent, it's known to people that belongs to them, is their place, the place for the people to go and connect.
It's vital to have a central place that people can go to. Yes, a central event like this, but we're not here on Monday, whereas a central space that is permanently focused on the Latin American, or the different cultures, or the multicultural, or the refugees is vital, because otherwise people, especially the new arrivals, don't know where to go.
It's been invaluable having this space here to come, to gather periodically, as we do every fortnight, and we chat, we have a good time, we have games nights, we have, little projects here and there that we attend to, so yeah, it has been good to have this space because prior to having this space, we used to meet at members' homes.
It gives us the space to, once we are in here, you feel like you're in another world. You stepped into another world. You feel comfortable, you feel relaxed, you're able to talk. I think it's a great initiative if spaces can be provided to other men from other communities or other areas, because a safe space is a starting point.
The changes we saw in this project in our Burundian community is before background, men used to be together. Since I came in Australia, was no anywhere men can meet. But since we got this project, a lot of people come together. Men are coming together, discussing about their problem, like how it was back in Africa.
I think it's really an important thing for the council responsible for this area to continue giving these opportunities to many communities as possible.
So facilities are very important because that's where on the weekend we meet together, we talk about mental health, we talk other also health issues among ourselves. Everything I've been receiving from MCCSA about mental health, I was sharing with the Burundian men.
We're meeting every month to look for my friend, and talking about my life and anything problem we see in Australia. Very nice and good for the community.
After being trained in that project, I have the knowledge in order to know how to speak with the people in our community.
The first aid mental health training helped me to increase my knowledge how to support Burundian men, and also I shared with the other Burundian men how we can support other men.
Every 2 weeks to call the people come together to share barbecue, to share a story about our life. Now the men, they're proud to know different support. We can balance. Now the issue is reduced because they come every 2 weeks and they share.
I'm a doctor, and I am not new about it to talk with the people. I know how to talk with them. And about mental health is a big issue. I know it's not easy, but with the multicultural community South Australia, after being trained, we have other knowledge in order to know how to talk with our people if you are men. Now I think a lot of people, a lot of men from our community now are improving in their mental health.
This kind of grassroots activity that develops the capabilities of communities to care for themselves, and more importantly, individuals to care for themselves. Also, I think helps provide the skills to the blokes who participate to have a conversation with their general practitioner with some more confidence about dealing with the issue. And I think the final point I would make is what it does is it removes this issue of stigma by normalizing the problem across the population.
But just the ability to get men together. Men don't usually talk. And our background, the macho man-like way of doing things, we break that down when we're able to interact as men, because we don't do it every day. It's new for men from a cult background. All the guys have had a positive thing to say about the interaction, and that's why we keep coming.
We're now saying that we tell the community that it's okay to be vulnerable for the men. It's okay for men to talk to each other about their mental health, because we are all human beings. This is the message we are imparting to men there.
Because of this mental health, I think I'm feeling very all right and believing in myself. I feel free when I talk about mental health, and I feel that I'm okay.
If I can give an example, one of our brothers just called me, said, I just called to say hi. I haven't heard from you for quite a while. And I think that is the things that we're supposed to be doing. So overall, this mental health program has helped us.
I said we should keep on doing it. We should keep on engaging in this program. And I think it's better for all of us. We have experienced it already, and we can tell them, and we can invite them in some of our programs. And then we have the whole community involved, Kabudu and the whole community we involve in all aspects.
So I will encourage every community that's here in South Australia for the men to find a way to come together, form a small group, start meeting, find ways you can get support. It will help you in the long run.
We do have our ups and downs, and sometimes we do need support. And so members of your men's group, you find amongst the men's group, you have your friend there, a colleague, so the trust of supporting each other, I think, is necessary.
The stigma is dwindling in terms of the effect on us, because now we see a lot of people now coming out and saying things, even sharing their own personal experience, and sometimes even talk about some things that are happening to them that they would have never talked about. Now, when we talk about mental health thing, we don't think, they might think that I'm sick or something is going on with me, which generally men don't want to talk about.
I think it was. I think people, it's the typical thing when you get into a room and no one actually knows each other. They don't, it takes a while to be forthcoming. Right? But as the project actually and the training start going and getting momentum, the interaction, the life experiences, what is happening at work, what is happening in the family scenes. We had some situations in there that really got us to think about it, that this is seen as real.
Yeah, very important to continue in the future, and very important because every time some people have problem, and some people shy, some people feel shame about them, because different culture in my country, in Australia. But here, different, Now they can speak, they can talk everything about the life, about, and they have more power to speak about any small problem, anything, you know.
Ultimately, government have some policy levers or some massive levers at play to make sure that that way of working doesn't become this niche or unique way of working, but fundamentally becomes the way that we go about solving complex challenges within community. And what we hope through these types of grant processes is a recognition that good processes, nuanced processes, can build really great outcomes.
As I said, it has changed my life considerably, because I only thought mental health was for just those who are mad, but I've now known that it is not those only the madness, but we have other activities to it, so we can discuss it and help others to overcome their difficulties.